episode 67 of the Real World Wellness Podcast. Hi everyone, I'm Christine Lehman, a nutritional therapy practitioner and reverse diabetes coach, which is also the name of my website. I help clients reverse chronic conditions naturally through diet, exercise, and stress management. I see clients virtually, so we don't even have to be in the same city or country. I'm offering some New Year specials that include a free 60-minute nutrition consult. Email me at christine@reversediabetescoach.com for the details. You want to contact me soon since I have a limited number of these free consults. I am delighted to welcome Dr. Aunna Herbst to the podcast today. Dr. Herbst has been a practitioner of functional medicine for 16 years. Before she attended medical school, she had a business for lifestyle counseling that included nutrition consultation and naturopathic medicine. She has since continued to study integrative medicine and functional medicine. Recently, Dr. Herbst fulfilled an understudy with infectious disease for chronic tick illness. She focuses on pediatrics, fibromyalgia, and chronic fatigue, which we're going to talk about today. Dr. Herbst has 2 children, ages 17 and 19, and a husband of almost 21 years. Public speaking and teaching are passions of hers, and she also enjoys yoga, outdoor activities such as kayaking and hiking, and reading. So welcome.
Thank you. It's nice to be here. Thank you.
That's great. And I love that you enjoy all these other activities as well, which I do. It sounds like you're a real outdoor person.
I am. That's my, I think that's my spiritual journey. My church, so to speak, is the outdoor.
Yes, I can understand that, especially when I see a good sunset.
Right. Just makes you in awe, makes you humbled in the moment, that's for sure.
Yeah, exactly. So as we noted, you specialize in chronic fatigue syndrome and fibromyalgia. So I was wondering if you could give us a brief primer on these conditions for people who are unfamiliar with them.
Sure. From a medical standpoint, chronic fatigue syndrome has a couple of different names. A more recent medical term is called systemic exertion intolerance disease, or SEID. For a long time, chronic fatigue was sort of a blanket diagnosis, often maybe thought not to be a real diagnosis, but it's gaining momentum in the infectious disease and immune fields. So there's a little bit more respect. There's some new research coming down the pipeline, which that's the chronic fatigue part. But also is by definition, a 3-month duration of excessive fatigue worsened by activity. In children, it's 3 months, and in 6 months of ongoing fatigue or persistent fatigue, especially worsened with physical or mental activity. Usually both categories of children and adults, they don't seem to recover with rest. So by definition, it's a clinical presentation. There isn't any definitive diagnosis biomarkers that we use, so it's very much is a clinical presentation diagnosis. And then fibro on the other side, fibromyalgia, by definition for the medical community, we consider it a widespread musculoskeletal pain that's usually associated with the fatigue. Usually most patients have sleep disturbances or sleep disorder of some sort, and oftentimes also accompanied by mood disorders. This also is a it's received a bad rap over the years, but it's definitely gaining momentum and recognition. There are definite consistent patterns that we see in medicine. And so now there's even, a medicine out on the market specifically for fibromyalgia called Savella. So in the medical community, if you go into a doctor, you'll have a clinical history diagnosis, plus they use tenor points, 11 out of 18 trigger points. If they're positive, then you gain yourself a diagnosis of fibromyalgia.
That is so interesting. So it sounds like one of the distinctions could be the amount of fatigue between the two?
Yes, correct. So they have some overlapping commonalities, the two syndromes that present. So fibromyalgia often is associated with fatigue, but their primary complaint usually is just muscle pain and excessive pain, especially with that exertion or activity. but they have a lot of fatigue that accompanies it. Whereas your chronic fatigue syndrome, if it's a straightforward chronic fatigue syndrome presentation, is primarily exhaustion, just flat out on my back, especially if I exercise or I have a really busy day, then it takes me 2 or 3 days to recover. That's a common complaint that we hear over and over again. So chronic fatigue is really predominantly fatigue. Sometimes they have some pain, associated with the fatigue side, but there's really not a lot of pain associated with true chronic fatigue.
I think when I was reading some case stories about this, what really struck me was how debilitating chronic fatigue syndrome is, and I would guess even fibromyalgia. Is that what you have found clinically?
Yes, and unfortunately, patients, because there is no biomarker or definitive test, it's very difficult for clinicians or physicians to say, this is what you have, and a lot of times we don't know the causes. There still isn't a direct correlation with a certain pathogen or a certain infection or a certain trigger that you can say definitively, oh, when you have that, you're going to get fibromyalgia, or oh, when you have that, that was your cause of chronic fatigue. It's sort of a vague, and from a functional medicine standpoint, a complex a disease presentation that is usually triggered by multiple things, or is caused by multiple things. So, no, it's difficult for people to diagnose, and it often gets misdiagnosed or missed, and it's really complex. It's unfortunate because unfortunately a lot of people are quite debilitated by it, and it doesn't seem to have the, recognition in medicine that a lot of patients really need or desire, because they go from doctor to doctor, and basically they talk it up to, oh, it's your age, or oh, you're a mom, or oh, it's hormones, or there's always some
right.
You might be tired, which is true, but unfortunately as it goes on and it starts really debilitating and changing your life, then it becomes a true chronic fatigue type syndrome or diagnosis.
Mm-hmm. Yeah, I was reading the story of one particular woman whose husband actually was a psychologist, and she no longer could hold down her job, and it was all she could do to have an hour or so with her children a day, so it was amazing how, frankly, her life shrunk.
Yeah, it's very debilitating. We see them day in and day out. I can speak personally about having chronic fatigue, and it's a game changer. It's a life changer. You can go from being at the top of your game, type A, to I can barely function. It takes all I have just to get up and get dressed. Yeah, it is very debilitating.
So is that how you became interested in it? You experienced chronic fatigue yourself?
Yeah, so yes, in some sense, yes. It came about after my first child was born, and I always say all heck broke loose then, and my body went from type A, overachiever, athletic, go-getter, involved in everything, to at my lowest point when life changed and I basically crumbled to my knees. That I had a choice between breastfeeding the baby that was crying, grating the carrots for my salad, or mopping the floor, because if I knew I did all three, I would be down and out for probably the rest of the night, maybe the next day. And what kind of a life is that, and what kind of a wife is that to come home to? So that was the low of the low, and there were many nights I would lay in bed next to my husband and think, I'm freezing cold, but to pull the covers up was exhausting. And so I just lay there until I finally couldn't lay there any longer cold, and I'd tap him and ask him to pull the covers up. So, yeah, those are pretty rough years of mine, but that's how I got into looking for more, reasons. Like, giving me the diagnosis of chronic fatigue or the diagnosis of fibromyalgia was sort of like, okay, that's nice, but why? What happened, and how did this happen to me at a young 23, 24 years old? What in the world went wrong? And so I wasn't happy with just settling with the diagnosis. I wanted to know more. And so that's how, I started getting into alternative medicine and the nutrition, and that definitely helped, but it didn't get me better, all the way better. And then over the years, as I learned more and more about the biochemistry, I just kept getting better. and then I got into the lifestyle counseling as my health was, much, much better. And then I decided that I was able to go to medical school at that point. So when my youngest child was started kindergarten, then I went off to med school.
Which takes, by the way, an enormous amount of energy and stamina, doesn't it?
Exactly. So I have to say that if I can do medical school for 4 years and then do residency, chief residence in my last few years, working 110 hours for most of those years, a year, a week, I think we can say that you can get better.
Yeah, that's amazing, really.
It's a big feat, and I'm still quite, I have to be respectful of my body, my time, and my nutrition. But it definitely was a blessing for me.
Mm-hmm. So maybe you can delve into a little bit of the answers from your own investigation. What I'm wondering about is, what do you think are the underlying causes, and are there biological explanations for this?
The two categories to me, just from seeing clinical case presentations, which I have to say that part of my passion here at Cleveland Clinic is to develop and write case studies. So I'm gathering information in both of these areas to present and to hopefully, have published and to share with my colleagues just some case presentations. So in other words, some things you see over and over again.
Right.
Start to say, hey, maybe there's a pattern here. And so if you separate the two disease states or the syndrome states, chronic fatigue for me and for my colleagues, we see a common pattern of usually some kind of viral or infectious trigger.
Mm-hmm.
And it sometimes can be really sudden for a lot of patients, but sometimes it's not. It's sort of this, I had mono when I was in college, and I got better, but I did notice that, I was a little more tired and kind of hung around, but I was busy, and, I was a typical college student. It's the same pattern story, but then I graduated and I got really sick in 2008, and all of a sudden that's when, man, I just can't seem to knock this, and it feels like I have mono at a time. So you hear patterns, so you think sometimes infectious triggers. Sometimes there's environmental or stressors, like emotional stressors can also be something that tips over the edge. But what we're seeing is a lot of these viral or bacterial titers, meaning your body recognizes a past exposure to, say, mycoplasma pneumonia, which is a bacterium. And so if it has had that exposure in the past and the immune system's healthy and the body is healthy and everything's trucking along just fine, then when you test the blood, those antibody levels or those markers for the past history exposure are normal, within normal range. But with these patients, you see these numbers are just exceedingly high, extremely elevated. And so you know that, one, there's an immune dysregulation, and two, there's probably a pretty heavy, some kind of infectious load. And then you try to go through their history, which is really important with these cases, to try to figure out, was it viral or was it bacterial? Was it a combination? Was it, some kind of tick bite? Was it mold exposure? And there's so many things and possibilities with some kind of environmental exposure at work. But usually there's a trigger, and sometimes it can strictly be stress-induced, divorce, having a baby, new jobs where you're under a lot of stress and there's a complete routine change.
Mm-hmm.
But the trigger is usually a trigger for dysregulating the immune system. So there's some kind of, it looks like there seems to be some kind of pattern. I know there's been some, if I'm talking too much, you can stop me.
No, go ahead.
There's been some recent research, the Center for Infection and Immunology at Columbia, where they are actually tracking the marker for inflammation, and they see it in the early stages of chronic fatigue in patients. And this was a small study, it was 300 and some people, and they followed it, and it was a consistent pattern over and over again, and we're seeing the same thing. So that's kind of where the chronic fatigue world is going. We're trying to find new markers and biomarkers and signs of inflammation that we can actually say, okay, this is up, and this is high, and this is caused usually by this. And so it gives us some direction as to how we can help treat them. Dr. Montoya over at Stanford is is an expert in the field, and he just came here to Cleveland Clinic recently to the Grand Rounds to present. And his theory is that it's mostly viral, a viral etiology or a viral cause, and we see that commonly in our practice as well. But I would say it's not a one-size-fits-all, and that applies also to fibromyalgia. Every person is individualized, and it could be one thing, it could be three things, it could be a conglomerate of things that push you over the edge or that is your driving force. But something is there, and then we need to sort of right the ship so they can get better. And then fibromyalgia is similar, except that I'm seeing in my personal experience a common trend of, you get the muscle pain, you have the fatigue. Most all of them have sleep disturbance, so there's some insomnia component. And of course, if you don't sleep, your inflammatory markers are higher, you hurt more, et cetera, et cetera. And I also see a common history of migraines, multiple chemical sensitivities, so they don't tolerate, cigarette smoke, exhaust fumes, perfumes, that sort of thing. And family histories, especially in women, of estrogen type-driven type disorders, endometriosis, menstrual migraine, fibrocystic breast disease. And to me, this is kind of where I have a passion for this disease state. I think there's a genetic component with an impairment in detoxification. And in medical world, we don't say detoxification, we actually say biotransformation. So, but for layman's purposes and for the public, you would say, I think there's an impairment with detoxification, because you see these trends over and over and over again with my fibromyalgia patients. And I think if you can help the patient assimilate or biotransform or detox better, and you can do that in a very organized fashion, your fibromyalgia patients get better. So I had that label thrown on me at one point in all this process of my ill health, and I thought, what in the world does that mean? And then I'd say it to the next doctor, and they roll their eyes and say, there's no such thing. And so I was like, well, dadgummit, I'm going to figure this out.
Right. So I know you also specialize in pediatrics, but these two conditions that we're talking about also affect adults. They affect both children and adults, is that correct?
Correct. I don't tend to see a lot of fibromyalgia in children, although I will say I have a handful of teenagers that present with a diagnosis from neurology with fibromyalgia. But I do see chronic fatigue quite a bit in children. Now, the definition for chronic fatigue in children by medical standards, and that's usually, by the way, we use it's called a case definition questionnaire standard, and that is a significant fatigue worsened by activity that's persisted for 3 months, and I think I said at the beginning, adults 6 months. But we do see it in children, unfortunately, and it's very unusual, you would think, for a child to be tired all the time. It's not normal. That is definitely not the norm.
Right.
So
we were talking also about it's common for these conditions to be misdiagnosed, and as you were talking, it sounds like there could be overlap with clinical depression, infections like Lyme disease, possibly celiac, and rheumatoid arthritis. So I would think the challenge is to first do what we call, in the medical profession, calls, a differential diagnosis.
Yes, correct.
So can you maybe run us through the process that you use to figure out, in fact, whether it is chronic fatigue syndrome or fibromyalgia?
Sure. So as a board-certified family practice physician, the typical time with a patient, new patient is, maybe 20, 30 minutes, and a follow-up patient is 7 to 15 minutes. So luckily, as a functional medicine provider here at Cleveland Clinic, my initial consult is an hour and 15 minutes with the patient.
Right.
If you can take an hour and 15-minute history, you can really narrow down that differential diagnosis. And so in other words, by a differential diagnosis, if I was teaching someone, I would say, if you give me you're tired all the time, your muscles hurt, and you have headaches, my differential diagnosis would be to list the top 6 things in my head and think of the top 6 things that could cause or could have those presenting symptoms. And so, like you said, that could be anything from, Lyme. It could be autoimmune disorder of some sort. It could be if you have, trying to think of some other things off the top of my head. You want to run down the list of things that it could be.
Right.
And so, and you want to rule those out. And so a lot of the ruling out comes with the history. So if, you go down the list and, they say, nope, I don't have any joint pain. No, I don't have any family history of autoimmune. No, I don't have any thyroid disorder. No, I don't have any, you go down the list and you can cross off things off of your differential, and then you're left with the top 3 typically. And then you do your lab workup. And here at the clinic for functional medicine, our lab work is different than your standard lab work. We do standard lab works, and we look at those and we optimize, their reference ranges. That would include like thyroid panel, the full thyroid panel, and the, liver and kidney function, metabolic panel, the typical things that mostly come back normal for most people with these 2 disease states. But then we take it up a notch, and we get to do a lot of biochemical testing. So we look at nutritional panels. So we're looking at all vitamins, water, and fat soluble. We like to look at your omega-3, 6, 9, 7, so all the omegas, the essential fatty acids. And we like to look at your minerals and your amino acids. And so all the building blocks for everything or every process, biochemical process, we look at. And so then we can tailor the treatment and sort of rebuild the foundation for this person. No matter what the differential diagnosis is, you are taking them up a notch in health, so to speak. You put the right gasoline back in the car, then they run better. We look at gut health, so we want to make sure they have good assimilation and absorption, and you don't have any fungal overgrowth, or you don't have any pathogenic bacteria that's hanging around causing some trouble, which can be a nuisance to the immune system. And so we really look at the foundational parts of the body, hoping to, when corrected by itself, just that alone, restoring some homeostasis. And so when the body rights the ship, and so it's not all crooked and gaining water and we're about to sink, which is how you present, now we're sort of upright, and we don't have our sails up yet, but we are upright and we're not getting water over the edges, and at least we are moving or sitting straight up and not sinking. And then you can take that differential diagnosis and really get nitty-gritty. So you rule out Lyme disease. You send them to a specialist if they need to be sent to a specialist to make sure you rule out an autoimmune disorder. You can do the labs for autoimmune. You can run, make sure they go see a neurologist and make sure there's nothing there that you're missing. You just run through the whole differential and rule everything out, and then you can start using nutrition and some other things to support the things that come back positive. So if we see viral patterns, or if we see bacterial patterns, or if we see a fungal pattern, or if we know there's a huge emotional overlay, we need to make sure that we get them to, we have a health coach on staff. We have a nutritionist on staff, so that's part of our group approach to the patients, which is a functional medicine approach. But if you need someone outside and beyond that, like you need, a psychologist or a counselor, a psychotherapist, or a long-term health coach like yourself. So we usually encourage all of that. We think it's a multifaceted approach that we have here. So I'm very lucky to be involved in this project here at the clinic.
Right. No, I love that whole integrative approach, and with the team that you have there in place. And so let's talk about a little bit of the teasing out of what you would do, for example, with somebody with depression. I can see, with just, if you don't mind using your own example, after pregnancy, I could just see a doctor going, but don't you have postpartum depression, for example? So how do you kind of counter that? What makes this really different?
You make sure that you rule that out, because it very well could be part of the presentation. But typically, again, if it's been persistent more than 6 months, that's not usually postpartum depression. So a lot of things start to work their way out with the time, and then once you do your workup, you can say, it's not this or it's not that. Depression actually comes, it's interesting that you pick depression, because one point in my health escapade and my journey to regain health, they kind of, I felt like a lot of doctors just sort of were frustrated and they just throw their hands up, or they thought I was making it up or whatever. But the straw that broke the camel's back for me was a physician that I went to and I sought out because they were supposedly the best of the best. And the one thing they said was, well, I've done everything I can, but oftentimes I'll try a tricyclic antidepressant. And I thought, I'm not depressed, although I was starting to wonder, maybe I am, maybe it is all in my head.
Right,
but I just know my heart that I wasn't. So yeah, I think there's some overlay, because I'm sure after you feel so crummy for so long and nobody tells or offers you any promise of getting better or even gives you a definitive diagnosis, you feel pretty despondent and depression does set in.
Right. If you didn't have it before, you can have it after because of the lack of validation.
And you have to rule it out. So you want to get a good workup. So that's where you involve, your psychiatrist, and you make sure you do the proper questionnaires. And so anytime you have a suspicion, if I suspected postpartum depression, I would definitely want to make sure I ruled that out and treated it if needed to be. So.
Right. And the other one I thought was interesting that you mentioned, and you specialize in, I think, a little bit at least, is Lyme disease, tick-borne illnesses, because that's also got one of these rather complex, presentations, and people don't often recognize it, unfortunately. It may not manifest itself easily until months afterwards. I mean, I had the telltale bullseye rash, but I didn't realize that I think it's less than 50% actually get that. So having treated a few people with nutrition who had Lyme disease, I was puzzled initially at why they didn't know they had it. It went on for so long undiagnosed, but now I know why. So anyway, what have you, and I think that would even complicate things because, we talked earlier about viral infections, and so it seems like the overlay between Lyme disease and this could be somewhat similar. What am I?
Yeah, so when I was saying earlier, one of the common patterns we see is infectious etiology or infectious causes, meaning it could be viral, it could be bacterial, it could be fungal, it can be a lot of things. And one of the big ones you see is a past exposure of a tick bite, whether or not they were diagnosed with Lyme or not. There was definitely an exposure, and it's a very controversial area. And I work in an institution that is very much along the CDC guidelines. So you get the Lyme disease if you have the classic presentation, and you get your treatment, and that's it. Now there is a recognition across the AMA of post Lyme syndrome. In other words, you might have symptoms that linger after you've been treated, but it's not an ongoing chronic Lyme infection. So there's a lot of argument back and forth. There's kind of a split infectious disease community where half of them say one thing and half say another. So you tread lightly back and forth there, but it definitely is a common pattern with patients. They'll say, oh yeah, I lived in Wisconsin, I had a lot of tick bites, oh I remember that, yeah, I had a bullseye rash, I got treated though, I was fine. And then, 20 years later, they had some major stressor in their life, and all of a sudden all their joints hurt, and the fatigue jumps on their back like an elephant. And so, that is possible that it was a resurgence, or it was a trigger to the immune system, and the immune system thinks that there's a problem still, and that's what's driving the inflammation. So even we don't know, and I do have a passion around that field. I'm still learning. And we diagnose here, and we'll do initial treatment, but if we feel like you need long-term treatment or you need more in-depth treatment, then we usually send the patient out to a Lyme-literate physician or someone, infectious disease that's appropriate.
Mm-hmm. Yeah, I interviewed Dr. Schweig on my podcast here a while ago, and that was very fascinating because ticks are really prevalent on the West Coast, and even he's in Berkeley. And he was even saying some people have them right in their backyards, so that was kind of disconcerting. Right. You can enjoy relaxing in your backyard and get a tick bite.
Yeah, you just fall out of the tree. Interesting about that comment. So I came from Oklahoma, and it's supposedly not an endemic area for tick, but I tell you what, I bought property, and we joke and say that it was a tick farm. You can't walk anywhere without getting, at least 10, 20 ticks on you in the height of the season. So,
oh my goodness,
they're pretty widespread.
Yes,
Yards and in the woods.
exactly. Well, we have them here too, and as a hiker, I've learned to take precautions with what I wear.
Mm-hmm.
So,
Me too.
yes, yeah, absolutely. And then the other thing I was wondering, rheumatoid arthritis, I would think that the overlap might be more with fibromyalgia. Is that correct?
Not really with rheumatoid arthritis, but with some autoimmune disorder like your connective tissue disorders, and also with like your myositis, so your muscle type autoimmune. Rheumatoid arthritis is pretty straightforward in that it's really joint specific, and so it gets confused. I'm glad you asked that, because sometimes people, but they could also have fibromyalgia and have rheumatoid or have an autoimmune disorder, and they actually say that you're more prone to have fibromyalgia if you do have an autoimmune disorder, but definitely you can rule out rheumatoid pretty easily. It has a classic presentation in the office, and then by clinical exam, and then it also has some lab markers you can check for. And they all usually say, it's joint pain, swelling. But I do see a common trend. A lot of your autoimmuners do have fibromyalgia. So there's definitely, I think, an immune component or inflammatory component.
I had a client recently who just had shoulder pain recently, and so it wasn't widespread. It was just somewhat isolated, but it was really severe. And she also suffers from fatigue, has had hair loss, and I thought, based on her initial presentation, that we were looking at celiac disease. But it's a process, as you know, of ruling things out. So I just thought, and she had trauma in her background, traumatic stress.
Oh, yeah.
And which could have contributed. She had alopecia as well that started shortly after that. So this is one of, the kind of complex cases I sometimes address. And so I was just wondering, though, about the shoulder pain. Is it possible to have fibromyalgia in just certain parts of your body where you notice the pain more than others, or is it really more systemic?
It's usually pretty systemic, and you really truly can't give someone the diagnosis if it's just one localized spot, at least by medical definition. Now, you could say that they have muscle pain or joint pain or muscle stiffness, but to get, if you're going to bill for it and get a clinical diagnosis, one localized spot wouldn't qualify for a true definition.
Right.
Actually, yeah.
So I would.
Sounds like she has definitely a complex system, which is common to, like you say, with functional medicine patients.
Yeah, definitely. I think an autoimmune condition, but we're still doing a lot of different tests and working through that. So this is and she and the kinds of patients that you see are where it is common for them to see a lot of different specialists and doctors. And I would think once you make the diagnosis, there is a sense of relief on their part to know what they're dealing with.
Yeah. We consider it a stepping stone, and it's kind of nice to have a diagnosis. But then you should, I think, as a patient, an active participant in your health, you should say, so yeah, I have this. Now, why do I have this? And what can I do to keep the immune system in control? What can I do to support the system so that it's not so dysfunctional? So yeah, we use a diagnosis, which we love having diagnoses because that kind of helps us, whittle down the differential. We use it as a stepping stone. Like, this is where we are. All right, how do we fix it? How do we make the system right?
Right, and I think what you're saying is very important about the client or the patient being a participant in this process, an active participant. So let's talk about these steps. So you have that conversation, you've you think it's chronic fatigue syndrome, for example,
Mm-hmm.
then how are you going to proceed from there? What kind of conversation are you going to have with the patient?
So if we already have our diagnosis and we're starting to work up, first thing we're going to do is make sure that we restore balance from a nutritional standpoint. So they will meet with the nutritionist, and that will entail a certain specific diet tailored to the individual, especially based on their diet needs as well as their test results, the deficiency results, and then any food sensitivities they might have that we've identified. So that's the first step. They have to become an active participant and make sure they're, try as best they can to put the right kind of foods in the body. They also want to make sure that they are getting enough sleep, so that becomes a big part of our discussion. We optimize sleep as best we can. The deep breathing is a big part of my regimen. Some kind of meditative breathing or prayer or something where there's no stimulation and you're learning to just sort of slow down.
Right.
We have to get that fight or flight mode kind of calm down, so that's important. We talk about, of course, balancing gut health, making sure we have good bowel movements every day. We don't have any bloating. We're assimilating things properly. We're breaking things down appropriately, so all of that plays a role. And then that becomes, we can give you the guidance and we can do the testing, but it becomes the patient's responsibility to implement all of those things. They'll do that for a while, they'll come back, and then we'll fine tune it. We'll start looking for, what was the trigger? What was maybe there's a tick history. We better rule that out. What if there's a viral infection, past history? We need to make sure that's ruled out. So that's how we go about it. And it's a whole team here that does it.
Yeah, it sounds
That's
like
the basic part.
that's interesting that you have them make certain changes. Lifestyle changes. I think we want to emphasize this, that lifestyle changes is an important piece, correct?
It is the piece.
The piece, yeah.
We can give you all kinds of tools, and we can do testing. We can tell you this might be the cause and this is where you're deficient, but until you implement them, until you make that lifestyle change where you become an active participant in your health, otherwise you're just a passive participant and you get a prescription handed to you. You have no idea why you're taking it or what you're doing with it, and off you go. And I used to encourage my family practice patients to be active. I want them to research. I want them to question. I want them to take charge. I mean, I'm just a guidance, and then they're the one that actually rights the ship. They're the one that actually gets them well.
Absolutely. So do you recommend any exercise or just very low, movement type things, low impact movement like yoga?
This is where I differ than most clinicians with my fibromyalgia and my chronic fatiguers. So when you first initially present, you're usually pretty bad. You're pretty tired. You're exhausted. You can barely get up and get dressed and take a shower. To tell them to go and exercise, or you're hurting so bad that you can hardly even put your clothes on, to go tell someone to hit the gym for 45 minutes, and the more that you exercise, the better you'll feel, is a joke.
I totally understand that.
And I think there's a principle behind that. You already have an upregulated inflammatory response going on. And when you exercise and you produce, even if you're not feeling well, but also if you're feeling well and you exercise to a point where you're producing more oxidative stress, and that's all rising, that's not doing anything positive for the patient. And if you're healthy, you can right that and you can correct that, and your body can use antioxidant stores, and it can make sure it pushes the lactic acid and all of the inflammatory markers out into the bloodstream and the lymph system, and get rid of it and achieve homeostasis quickly. So for a healthy person, exercise can be very beneficial because it does do positive things. But for a person that's already in that oxidative stress, cell damage, DNA mutating mode, they don't need to be adding a boatload of oxidative stress free radical damage going on. They don't need to be mounting a big giant inflammatory cascade. So for my patients initially, I actually tell them part of their exercise or what they're doing for exercise for me is deep breathing,
Right.
meditative walking. So they're going to, take a nice little walk out in the sunshine. If it means they're going to do it for 2 minutes, then great, they do it 2 minutes. If it means they can bump up next week to 5 minutes, then fantastic. I want them to just do as tolerated. Maybe a little, start with a 5-second plank hold, something for core strength, but nothing excessive. If you're hurting and it takes you 8 hours to recover from 2 minutes of exercise, it's not helping. And so the other thing that I sometimes will do initially is have them do infrared sauna as tolerated as a form of exercise. So it kind of gets the heart rate, it gets them sweating, not very long because a lot of them can't tolerate it for very long, but it does help. So those are the things we start with. We start really slow and increase as we get better. Once we get our nutrition built back up, a lot of times they can handle 5-10 minutes of exercise, gentle exercise like yoga, something that's breathing focused. I definitely tell them no aerobics, someone yelling like boot camp exercise.
Right, or kickboxing.
That just puts them in fight or flight mode, and we're going backwards again. So we tend to steer away from those until they get better. I remember the day that I went from 5 to 7 minutes on my exercise routine. I was doing yoga at the time, sun salutation as much as I could. I remember I got to 7 minutes and I was like celebrating. I high-fived my husband, like, yay, he runs 12 miles a day, and I'm like, I got to 7 minutes, woo! I was so excited, but I now work out, 45 minutes, 30 minutes almost every day, so you definitely can get there, but
right, and I think
it's important.
Right. Yeah, sure, to start with baby steps and what you can tolerate.
Absolutely.
So how long, if we can go back to your journey for a minute, you've had a rather amazing journey here, it sounds like, with a lot of, gradual healing, if that's the correct description. So how many years did it take you from when you figured it out, what you were, what you had, to where you are now?
Well, let's see, my daughter was born in 96, and my son, 98. Just adding it all up.
Yeah.
It was a slow journey. I would say the first 2 years, it took me 2 years to really say that I was well, and that's when I actually started doing the lifestyle counseling. So I was well enough to do sort of a part-time, even consider opening a business. So 2 years. I unfortunately didn't have any guidance, so I was out there flailing around in the alternative world by myself, learning on the fly, researching, and I couldn't afford anything. So, at one point in my life, I was actually packed my babies in my little pack, and I volunteered at a herb shop. That was kind of part of the story, but yeah. So that way I could get some help with my herbs, and my vitamins. So anyway, so it probably took a good 2 years, but I would say from a clinical perspective now, with the protocols we have in place and the research and the testing abilities and guiding people, on average, to get your feet back underneath you, it's 3 to 6 months, and then to be, really well with chronic fatiguers and fibros, it's going to be a good year, probably a year, 12 months, 14 months or so.
Yeah, I would love to maybe end the show on a positive note of someone that you can just share anonymously their recovery.
Sure. Gosh, I haven't, So, let me think of some really good ones. Well, I know one, actually. So, was prominent community member at one time in my career of medicine, was debilitated, gradually became debilitated with chronic fatigue and also fibromyalgia, migraines, the typical presentation that we see, a bunch of different things going on, joint pain, a whole nine yards. Lost a job. Well, actually was on disability, I should say. And, they keep renewing, and then you have so many months, and then you've got to renew again. We're kind of in that, I need to be renewed, but I don't know they're going to renew it. And the not, I'm going to be out of a job and I don't have the income, and that story. Worked really hard, couldn't afford a lot, so we didn't get to do extensive testing, but basically just did a lot of nutritional replacement, did a lot of lifestyle, so a lot of meditation and walking and massage and nutrition, and within about 3 months, definitely better. We were about probably 40% better. By the 9-month mark, had decided that they were going to go back to school to change their career. And then by the time I left my last practice, they were done, graduated, and were going to be hired as a nurse in the local area. So big change.
That is a big change. And what was they went from being, what was the previous career to being a nurse?
Yeah, so bank telling, odd jobs, just nothing they were really happy with. So it was just sort of a big aha for them.
Sounds life-changing.
It was, and you know, I should still say to this day, I'm actually quite thankful for what happened to me. Wouldn't want to go through it again, but thankful for what happened to me. So, and I can say the same thing for me. So.
Well, and I would think it gives you even more credibility with your patients because they know you've lived it.
Yeah, maybe so. I hope so. It definitely can make me empathetic. Sometimes I cry with them because I can feel it. You know, sometimes you have to. You learn in medicine sort of. They try to teach to be detached, but I think part of that makes me who I am and what I do. Be special.
Right. Exactly. So where can people find you if they want to consult with you?
So I'm at the Cleveland Clinic Center for Functional Medicine, and I guess the best way to call or schedule an appointment is it's area code 216-445-6900, and there are a group of us here, 5, 6 clinicians that practice here in the group, and we're growing rapidly. So plenty of like-minded colleagues that I work with.
And
people.
Yes, and I believe Dr. Mark Hyman is the director.
Yes.
Yes, and he is. Most people have heard of him. So.
Yes, quite a few people. Yeah, I would say.
So I will put that link in the show notes as well as any other relevant resources. And I want to thank you so much for being on the podcast today.
Absolutely. I feel honored and blessed that you asked.
Oh, well, thank you. In the next episode, my fellow nutritional therapist and co-host, Amy Berger, and I will talk about oxidative stress, what causes it, how you can replace certain nutrients and antioxidants to help you combat it, and why it's related to type 2 diabetes and other conditions. So stay tuned for that episode. Have a great week, everyone, and be well.